In Alberta, healthcare aides, known as HCAs, are an important part of the healthcare team. As frontline healthcare workers, they play a major role in providing Albertans quality, person-centered care. HCAs work collaboratively as part of the healthcare team, under direct or indirect supervision of a regulated healthcare professional. HCAs provide personal care and other essential health services in hospitals, continuing care facilities, group home settings, and other healthcare settings. HCAs work with patients with chronic, complex medical conditions, physical and cognitive disabilities, and those who require palliative and end-of-life care. HCAs can have different job titles depending on where they work, such as residential care aides, mental health aides, and psychiatric aides. There are two main documents HCAs should be familiar with, as these documents help direct practice and the provision of safe, quality care. The Competency Profile for Alberta Healthcare Aides and the Continuing Care Health Service Standards. HCAs are responsible for providing care within the boundaries of their individual competence and education. The Competency Profile for Alberta Healthcare Aides outlines the knowledge, skills, behaviours, and attitudes required by HCAs. In Alberta, HCAs learn from these competencies by attending an approved healthcare aid program that follows a provincial curriculum. The Continuing Care Health Service Standards is the document that outlines the competency status required for HCAs that work in publicly funded facilities in Alberta. Publicly funded facilities include Alberta Health Services and its contracted operators, such as any supportive living facility that receives funding from AHS to provide healthcare. 3 competency statuses are considered to determine if a healthcare aide meets the requirements to practice in Alberta: certified, substantially equivalent, or deemed competent. The Alberta HCA Directory is a web-based database for HCAs in Alberta and is often referred to as the Directory. The Directory provides important information about HCAs, including their competency status for employers. All HCAs who work in publicly funded facilities are required to be enrolled on the Directory. Although HCAs who work for privately operated facilities are not required to be enrolled on the Directory, they are encouraged to do so. HCAs in Alberta are currently unregulated. Regulation of HCAs means that this profession will be legislated under the Health Professions Act in Alberta. The HCA regulation is currently being developed. Development is accomplished through consultation with relevant stakeholders and HCAs. There are changes being made due to provincial legislation, changes that will affect the Health Professions Act. These include separation of regulatory colleges and professional associations, changes to the bylaws, regulations, and standards of practice of regulated professions, introduction of healthcare aides as a regulated profession, and the creation of a centralized health professionals directory. The CLPNA will be changing to become one college with 2 distinct professions: licensed practical nurses and healthcare aides. The CLPNA will also undergo a name change to become the College of Licensed Practical Nurses and Healthcare Aides of Alberta. Updates on the HCA regulation are available online at hcaregulation.com.